call our meeting to order tonight. Renata, if you could do the roll call, please.
Gookin,
Present.
Miller,
Yes.
English,
Here.
McEvers,
Here.
Evans,
Here.
Wood.
Here.
If we could rise for the invocation, we have Pastor Paul Vanoy with Candlelight Church with us tonight. Welcome, Paul.
Thank you. Thank you, Mayor. Council members, it's times like these, it's a good thing we have faith. Amen? Would you join me? Lord, we are privileged to come into your presence tonight. So many people in our community feeling anxiety, some panic, some very nonchalant. However we're processing the things that we're going through right now in a community, we are thankful to have a relationship with you, to know that your eyes are upon us. You care about us deeply, and you love us all. We're so thankful for that. And today, Lord, as we begin this meeting, we reflect upon the needs of our community and the people of our community. We know you're about people and we're about people. Our mayor and our council members are here because they serve this community and the people of this community, and we care very much about them and all the things that they're going through. We're asking you, Lord, now at this time to give us peace, to give us a sense of calm and trust, to look to those that are in leadership with confidence. We do pray for those in leadership that they will have your wisdom and your knowledge in times like these. We know, Lord, that you will and can give us that insight, that peace, and those marching orders that we need at a time like this. And so, Lord, we look to you and we look to you alone. You are truly our only source of strength and refuge. You said to us, call upon me in the day of trouble, and that you would answer us, and then we will glorify you. Our desire is to glorify you, Lord, and so we look to you for those answers, for those marching orders, for that peace. I do pray today for our mayor. I pray for our council members. I pray for all of those that serve our community, for the pastors in the community, for all the groups that help others. Let us do that job with excellence, we pray. In Jesus' name, amen.
Amy, lead us in the pledge, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. Mayor, I'd like to make a motion to add item F2, presentations of declaration of local disaster emergency, to the agenda as an emergency item. It is necessary to add this to the agenda at this time.
Second.
Motion and a second. We're adding item 1 and 2 to our agenda tonight under presentations. Is there any further discussion on that? Roll call, please, Renata.
Gookin,
Aye.
Miller,
Yes.
English,
Yes.
McEvers,
Yes.
Wood,
Yes.
Evans.
Yes.
Motion carried. I'm going to switch things up just a little bit, and I'm going to have public comment after our presentation, but I wanted to invite Laura Whalen with Panhandle Health to address us, and then after Laura's message, we'll have Chief Gabriel and Chief White come up as well and give us some updates. So thank you for being here, Laura.
Thank you, Mr. Mayor, members of the council. My name is Laura Whalen. I'm the director of Panhandle Health District, and wanted to give you an update on what's going on in your community with coronavirus or COVID-19. We all know globally the numbers change daily. Over 180,000 cases with a reportable 7,426 deaths. Coming from, over 120 or more countries. In Idaho, we have 8 cases, no deaths, of course. The cases are in Ada County, Blaine County, Madison County, and Teton County. In North Idaho, we have no cases. We are testing. We just got a batch when I was driving here, they all came back negative. I'll have some more results back tomorrow. I really need to commend Kootenai Health with what they've set up and what they set up in rapid order in the way of testing. It's unique in Idaho. They initially set up the tent that was in their emergency room parking lot. The purpose of that was if somebody came in with COVID-like symptoms and was pretty ill, rather than bringing them into the emergency room and putting the healthcare workers at risk, they could test them away from folks. And then very shortly thereafter, across the street, they set up 2207 Ironwood, which is kind of a drive-through testing. Certainly, the clients that go through need to have a doctor's order. There's some criteria that they need to fit, including travel to one of the affected countries, and being symptomatic. And by symptomatic, I mean having a fever, 100.4, a cough, and respiratory symptoms. Yesterday, they tested 55 or so. Today, 141 went through the drive-through testing. So we are testing. And the tests had been going to the Idaho Bureau of Laboratories, our state lab down in Boise. Yesterday, I think, they started sending testing to University of Washington. Public health will continue to receive, as per reportable diseases, positive results. And I say again, we've had 0 to date, but we have been testing in North Idaho, and it's a credit to your local hospital. Certainly, we've been in incident command. Kootenai Health is in incident command. The EOC, as you're aware, is set up. Our partners have been incredible throughout this couple-week period, 3-week period. We've set up a hotline. We did that 2 weeks ago, where people can call and get their questions. It's now open 6 days a week. Monday through Friday, 8 to 7 p., and Saturday, 9 to 1 p. Yesterday, we had 345 calls. Today, when I left around 5, we had 447 calls. People that are worried about the virus. The biggest concern, I would say, in North Idaho right now is PPE for our healthcare workers, our first responders. The governor is.
PPE stands for?
I'm sorry, personal protective equipment, most especially the N95s, the masks that are the respirators. This virus is spread by droplet, and it's very contagious, which is why we're seeing such spread. But it's not. It's kind of a big droplet. Certainly, it can be aerosolized if you're putting in a ventilator or some such thing. There's potential for smaller droplets to spread and be in the air. But this is more if I were to sneeze and you were right next to me and I sneezed on you or coughed on you and I had the virus, you have the virus. So that's why the emphasis on respiratory etiquette, on social distancing, on washing your hands, on most importantly, and this time, you always tell people, oh, stay home if you're sick, but do people do that? No. This time we really mean it. Stay home if you're sick. So the president came out last night with, I don't know if you watched, or yesterday afternoon, if you watched his press conference, but he has 15 days to slow the spread. As I said, we're all susceptible to this virus. It's a novel virus. That means no human has ever, it's brand new. It came from a bat, supposedly to an animal called a pangolin, and then somehow into a human. So none of us have had any experience with it, making us all susceptible. Most people with this virus, what the data is showing, are going to have a mild illness. They're going to flu-like symptoms. They're going to feel not very good. They're going to have a fever. They're going to have a cough. They might be a little short of breath. 80% of the folks, 15% of the folks are going to be pretty ill. They're going to end up in the ER. Their oxygen levels will be low. They may need some oxygen. They'll be in a hospital. And 2 to 5% are going to end up needing a ventilator. They're going to be really critically ill. It's respiratory. It's primarily respiratory. So the 80%, the vulnerable population, these people that are going to end up critically ill, are older folks, anybody with an underlying condition, heart disease, lung disease, most especially COPD, smokers, stop smoking cigarettes, diabetes, being immunocompromised, having liver disease. So these are the folks we're trying to protect. We're trying to, the country is trying to stop the spike from going here, everybody getting sick all at once, for the purpose of preserving those hospital beds and having it just be a more gradual, people are going to get ill. This is not going to prevent the illness. There is no cure for this disease. Those that are going to go through it are going to go through it. They're developing a vaccine. This might be a good thing for, people to think about vaccines, but that's more than a year out. So in the meantime, stay home if you're sick. Respiratory etiquette, clean surfaces, that's all we got in our toolbox right now. So what the president did yesterday in his 15 days to slow the spread, he changed, it didn't change things up a lot, still the same messages, stay home if you're sick. One of the new things that he said that, probably we all knew, is that if someone in your household has the virus, everybody in your household is going to stay home until that virus is cleared. And think about your dad, think about your elderly friends. They need to take some responsibility on their own, avoid large crowds, social distancing, but we do too. We owe them that. The other thing that the president said yesterday, and I think our governor will be addressing it tomorrow, well, I know our governor will be addressing it tomorrow at 9 o'clock our time in a press conference, is about president called it social gatherings. So I think that the governor will explain to us that what the president means is instead of gatherings of 50, taking it down to 10. Think about how we're going to have meetings. Think about how we're spaced at our tables with social distancing. And then, the other big point economically that's going to hit everybody is he's asking for 15 days. Remember, this is 15 days and then to be reevaluated, is to avoid eating or drinking at bars, restaurants, and food courts. Use drive-through, pickup, and delivery options. Asking us to think about discretionary travel. Do you really need to get on that airplane? Don't get on that cruise ship. And then certainly don't go into a nursing home. That is truly where, if we look at where the deaths we have in this country are, most of them are in Washington. Most of them are in King County. They have 46 deaths in King County as of today. 30 of them are associated with that long-term care facility. Either clients or actually clients, because the younger folks are going to get through the illness. But the folks that have passed away over there in their 80s, in their 90s, in their 70s, folks with underlying conditions. So, press conference tomorrow at 9 o'clock. Wanted to, Dr. Cook wanted to be here but couldn't tonight. He did ask if I could give you an update. I've been working very closely with our school superintendents in the 5 northern counties. The guidance, because things change so rapidly. They've all decided, -1 in another county, to dismiss schools until 6 April and then reevaluate. And what Dr. Cook wanted to share with you is that they are feeding kids. Any kid that wants to eat, any child that wants to eat, they're going to start feeding children, I think, today or tomorrow. Starting Wednesday, they're going to be feeding children at multiple locations: Fernan, Winton, Bryan, Bora, Skyway, and Nexa. Any of their students. It doesn't matter if they're on free or reduced, they'll all be fed breakfast, snack, and lunch daily. And on Wednesdays, they're opening an emergency child care at Ramsey Elementary for their K to 5 students of healthcare workers, emergency services, and first responders. Those two are the people we really need to protect, our first responders, law enforcement, healthcare workers. Because if they're not there, that won't be good. We need to have nurses and first responders available to help us all. With that, sir, I'm happy to stand for any questions.
Council, questions for Laura? Kiki?
Laura, is there like a frequently asked questions page somewhere at Panhandle Health District's website or something like that that you're gleaning from these phone calls?
Certainly, we have multiple links to multiple facts that folks have. You know, the bulk of the phone calls, the ones we had today, because I looked through the logs, we had 21 that we deemed high risk because of the travel and symptoms. The rest are, I don't want to say, I mean, they're worried, and I understand their worry. And I understand they want to be tested. But, you know, testing really should be reserved for those that are symptomatic. Because it takes a while to get the testing back. It takes, I mean, a test is not an easy thing to go through. It's a nasopharyngeal swab, which means it goes through your nose. It's a thin little tube that kind of goes all the way to the back of your throat and will make you cough a bit, because they're just testing for viral load. And we're doing our best. We have our Medical Reserve Corps is primarily staffing these calls. So we've trained them, and they're doing a great job, all volunteers. You know, again, I can't thank the volunteers and our partners enough, because we couldn't be doing this response without them.
I'm just hoping that there's a lot of information that goes out there, and it's changing sometimes hourly. And so we look to Panhandle Health as the accurate source to factually respond to the questions. So I'm just hoping that, you know, if there's a way to answer the most frequently asked questions and we can refer the same fact back to the community, then I think that you guys are doing a great job.
You know, a very good point, Kiki, or Councilwoman. You've got to go to reliable, trusted sources. And certainly our website is one of them. The CDC is one of them. The National Institute of Health is one of them. And now there's a new one, President Trump's coronavirus.gov. There's so much information out there that is wrong. And I think fueling some of the anxiety that we're seeing in our community, almost an infodemic, if you will.
Any other questions from council? Christie?
Mr. Mayor, thank you. Laura, what is the availability of testing for those who need it? What are our supplies?
You know, as I said here, we are doing testing. If people meet the criteria, or if a provider thinks that they need to be tested, they can be tested through that drive-through.
Do you have the supplies you need, the health professionals?
We're low on PPE. You know, you've got to be in full garb to test someone, because if someone thinks they have coronavirus, that healthcare worker, for their safety, has to be in full PPE. And that is an issue. I know the hospitals have a call with the governor tomorrow to discuss that issue. And it's not just an issue for healthcare providers, it's an issue for our first responders as well.
Thank you.
Some in the state are experiencing shortages of the actual median that you put the NG, or the NP, to the nasopharyngeal swab into. But I think we're okay here for now. I mean, this is not, I mean, I don't, there's lots of different data points you can look at, but this is going to go on for a while.
Other questions for Laura? Laura, if you wouldn't mind the website again for people that are listening at home to get.
Let me give them the hotline for COVID, 877-415-5225. Again, it's open Monday through Friday, 8 a.m. to 7 p.m., and Saturday, 0900 to 1 p.m.
And then your website again?
Just Google Panhandle Health District.
And it'll be there.
Yeah.
Okay, all right. So any other further questions? Thank you, Laura. Appreciate
Thank you,
all
Mr.
you're
Mayor
doing.
and Council.
Thank you. So I'd like to invite Chief White and Chief Gabriel. They've been working hard over the last week or so and have a lot to report, and Deputy Chief Greif as well.
Mayor, Council, good evening. Thank you. It's been a busy week, but I can tell you that we have been working diligently with ourselves, our partners, the county, the Emergency Operations Center that's up and running right now. We've been working pretty hard to try to stay out in front of this. Some of the things we've done in the fire department is we've completely changed the way we react to a general illness or respiratory call, and we limit the amount of people that go in there. Two reasons. One is about exposure. The second is, as Laura said, we need to keep our supply of the mask and the gowns. Getting those right now are difficult, although we do have a pretty good supply. KCMS, who our partner is, they are doing all the logistics on this, and they're doing their absolute best to stay on top of it. We've ordered a bunch of new masks. We should get here in about 30 days. But as I watched a webinar from the International Association of Fire Chiefs, they said there's a 1 billion mask shortage right now, and that a lot of them are done outside the country and they're not shipping them in. So that is going to be a problem that continues to move forward. One of the decisions I made that was very difficult was limiting the community into the fire stations. One of the things we love to do the most is public education and public information, but that we put the skids to that because we don't want people coming in. It's all in an attempt to minimize exposure. And our response is because of that. Our response is to the communities because of that. Councilmember Miller, great questions on the social media. You'll see that I've been sending you thing after thing after thing. What we are trying to do is only send you the information that comes from Panhandle Health, because they are who we look to for guidance. So the information I send you, we're going to do our absolute best to make sure that we get it from that one and that only source. Tom is actually the operations chief at the EOC right now, and Mr. Mayor, if I could, I'll have Tom explain what's going on there.
Thank you, Kenny.
So I'll just expand on what Chief Gabriel said and assure you that all the fire departments in the county, a couple of weeks ago, we got together. We felt like we were getting out in front of this based on what we were seeing over in Spokane Regional Health District and their fire departments over there. And we did modify our responses. Like Chief Gabriel said, you'll see us responding in each other's jurisdictions, our ambulance, Kootenai Fire's engine. And so we felt that it was really important to have a consistency across the county with responders all the way out to Spirit Lake, Timber Lake. And so some of the modifications that we made were if we encounter patients that fit the profile in Post Falls and Kootenai Fire's on scene and our ambulance goes over there, Kootenai Fire will continue the patient care in the ambulance to the hospital and not expose our crew, and vice versa if their ambulance were to come over to Coeur d'Alene. So our priority sits with the keeping the responders healthy, limiting the exposures, and like Chief Gabriel said, the things that we had to do were discontinue ride-alongs was the big one that we had to do. It's pretty common that we do ride-alongs for EMT programs, senior projects in the high school, and with our firefighter test that was approaching in April, it's pretty common that we'll see, close to 100 ride-alongs for candidates that want to test with us. So we felt the only way we could control who comes in the fire stations were reduce the ride-alongs, the public education events that we were going on, and of course the facilities. Station 3 is used a lot by the public for meetings and stuff, and so we had to eventually shut that down also. And I would entertain questions if you had any specifics on operations or responses.
Questions for Tom? Christie?
Mr. Chair, thank you. Tom, and maybe Chief White and Chief Gabriel can speak, as well as the mayor could speak to this. I think it's important for you to all educate the public on a little bit about the chain of command. People are looking to the mayor and council, who are very engaged, and the county commissioners. But if you said EOC, we mean Emergency Operations Center, could you talk about the chain of command so the public can be aware of how we're all operating and what that means?
So yes, so the EOC was declaration was declared, I believe, Sunday evening, and the EOC went into effect Monday through Friday, 8 to 5. And at this point, the Sheriff Wolfinger and Chief Way from Kootenai County EMS, they're sharing the incident commander role for the EOC. And from there, it breaks down into operations, logistics, planning, finance, and for example, logistics is pretty much their whole job today was trying to secure, like Laura said, PPE, the gowns, the eye protection, the gloves, the masks, not only for fire and EMS, but for law enforcement. So hand sanitizer, disinfectant spray, the things that we need just to operate and clean our equipment, our ambulances, our fire engines. And so those different sections in the EOC are, of course, day one was setting it up. Day two, we got really, really busy in there today. And we expect that to just keep moving forward as the week goes on. And like Laura said, as any reports come in, confirmation from positive tests, we'll get out on social media and you'll see probably more panic at that time. Did I answer your question?
You did.
Okay.
Thank you.
Other questions for Tom? All right, Chief White, we'll have you come up.
Well, good evening, Mayor and Council. Externally, the public should really notice no decrease in service from the police department. However, we started increasing some of our patrols around stores and supermarkets and things of that nature to kind of discourage some of the inappropriate behavior that maybe you've heard about in the news. Call prioritization discussions have taken place, but we're not implementing them at this time just because there hasn't been a necessity to do so. There's been a couple services that we've encouraged people to take advantage of. For instance, the cases that are not in progress, maybe you can make an online report and things of that nature. However, people still have the opportunity to go to the police station or still have an officer respond under most circumstances. There's a number of things that are occurring internally that the public won't see. For instance, some of our SRO duties have been redirected because the schools are not in session right now. All the functions that are statutorily required and essential services will continue as usual. We have a number of staffing models that we've created, and those will be implemented based on absentee levels that we may see or depending on the needs of the community. We have a rotation of specialty assignment personnel to core safety functions that might be implemented if necessary. Our IT department has conducted testing for all of our equipment to make sure that we can continue to operate as normal, even if we have to have some folks working off-site a little bit more than they are currently. Areas are being cleaned twice a day, things of that nature. We're taking adequate precautions to make sure our folks can continue to respond to the community as normal. And as I said before, the average community member should notice a zero decrease in service from the police department.
Any questions for the chief on this? Any questions while we have the three guys up here? Thank you very much. I know that you guys have been working 7 days a week, and we'll continue till we get through
Appreciate
this.
it.
Thank you
Thank
very
you.
much. So I have a declaration of a local disaster emergency, and this is a little lengthy, but I think it's important that I read all the way through this. Whereas COVID-19 is a respiratory disease caused by SARS-CoV-2 virus and is a novel strain of the coronavirus and had not been previously identified in humans. Whereas the CDC identifies a potential health threat posed by COVID-19 both globally and the United States as high. Whereas on March 11, 2020, the World Health Organization made the assessment that COVID-19 can be characterized as a pandemic. Whereas on March 13, 2020, Idaho Governor Brad Little declared a statewide state of emergency due to COVID-19. Whereas on March 13, 2020, the President of the United States issued an emergency declaration of the country in response to increasing number of COVID-19 cases within the U.S., whereas the Idaho Department of Health and Welfare and Panhandle Health District issued recommendations for mass gatherings and public events in order to contain and slow the spread of the virus. Whereas a local disaster emergency may be declared by the mayor pursuant to Idaho Code 461011 and relevant related sections of Idaho Code, whereas in accordance with the Idaho Code, the effect of such declaration is to activate the recovery aspects of any and all applicable local or intergovernmental disaster emergency plans, and to authorize the furnishing of aid and assistance. And whereas the City of Coeur d'Alene desires to take action in order to be proactive and help reduce the spread of this virus, and encourages our community members and community businesses to do their part to prevent and limit the spreading of this virus. Whereas the public interest and necessity may demand the immediate expenditure of public money to secure materials, equipment, and services from the private and public entities to provide disaster emergency relief and assistance to persons threatened, injured, or victimized by the unhealthy, unsafe, and unsustainable conditions of COVID-19. Whereas the public interest and necessity may demand the immediate modifications to processes, procedures, and fees of the city to provide disaster emergency relief and assistance to persons threatened, injured, or victimized by the unhealthy, unsafe, and unsustainable conditions of COVID-19. Whereas an emergency declaration must be filed with the Kootenai County Recorder's Office and given prompt and general publicity. Now therefore, I, Steve Widmeyer, Mayor of the City of Coeur d'Alene, by virtue of authority vested in me by Idaho Section 461011, do hereby find and therefore proclaim and declare that a local disaster emergency exists in the City of Coeur d'Alene, and that all efforts shall be made to protect the citizens of the City of Coeur d'Alene through activation of all local disaster emergency plans, utilization of the City of Coeur d'Alene and state emergency resources, and do all things necessary possible to assist those individuals threatened, injured, or victimized by COVID-19. To do everything reasonably possible to assist affected individuals and entities in an effort to respond to and recover from the outbreak. To follow the recommendations of the Idaho Department of Health and Welfare and that of Panhandle Health District by postponing or canceling all city-sponsored events meeting the following criteria. The event will draw audiences or participants from communities, states, or countries with confirmed community spread of COVID-19. The event will be held indoors and bring together more than 10 individuals where social distancing of 6 feet or more is unlikely or not possible. The event's primary audience includes or may expose high-risk populations, including adults over the age of 60 years and people with underlying chronic medical conditions like heart or lung disease or diabetes, regardless of the number of attendees, and to take immediate action and other reasonably steps necessary to prevent and limit the spread of COVID-19. The City of Coeur d'Alene recommends that the public follow the same recommendations of the Idaho Department of Health and Welfare and that of the Panhandle Health District by postponing or canceling mass gatherings and public events that meet the criteria noted above. This declaration shall remain in effect for a period of 7 days unless extended pursuant to the authorization of the City Council in accordance with Idaho Code 461011. So I'm going to sign this as of today, March 17th of 2020. And then, Mike, I'll invite you up to talk about the resolution.
Thank you, Mayor. So what the mayor just read was a emergency declaration that he's allowed by law to sign and make that declaration that lasts for 7 days. And so we have a resolution in front of you because I think the knowledge we have now that what we're dealing with is going to take longer than 7 days. So the resolution asks council to extend the emergency declaration for 30 days. That will then be revisited if necessary after the expiration of 30 days. So that's what we're doing with this.
Questions for Mike Dan?
Thank you, Mr. Mayor. So what kind of powers are we granting the mayor in this instance?
You know, it allows him to coordinate with staff and law enforcement, public safety to take steps as necessary to preserve, protect the health and welfare of citizens. Specifically, we're allowed to go around or not be bound by the purchasing laws. Say, for example, the PP&Es or the devices, protection equipment needed by public safety. We don't have to go get 3 bids. We don't have to go bid it out, things like that. We don't have to obey the existing bidding laws, state bidding laws. You know, that's one of the primary things that we can do. You know, by adopting this, it also, excuse me, allows us to get into the process of any federal or state assistance that comes down through the county and through the emergency programs that will be set up. So there may not be anything right now, but this will position us so that we can, by this declaration, position us so we can do that.
So get around the bidding laws and is there anything that restricts that only to items related to the disaster? I mean, we can't go out and just buy a car.
I think you would need to show a necessity for that. The statute talks about acting, in response to an emergency and the needs thereof. So I guess if a bridge collapsed, we could go build a bridge. But, dealing with what we're doing now, I don't think we'll come across that.
Does the declaration of emergency affect the open meeting laws or public records requests, anything like that?
No, those are state laws. The laws, the 46, 1011, and 67, 208 specifically have provisions about emergencies. So they're state laws that allow local governments to, under emergencies, act out of the ordinary in those. Public meeting and public records laws don't have that. So we do have ability to meet the open meeting law by telephone. So right now, as long as we have one person available with a microphone, one of you here with a clerk with a telephone, and then the ability for the public to have access, be able to listen to it real time. Excuse me. I think that would qualify. It's one of those things we're working through right now with the Attorney General's office. Some states have taken more extensive steps to say the open meeting law doesn't work in this environment with this epidemic going on. So we're gonna suspend those. We have not been. Idaho has not done that yet.
A lot of concern that I've heard out there would be, does this give the government authority to close businesses?
I think at this point that's a voluntary thing. We don't have the ability under martial law to, close a business. To be honest with you, this is uncharted territory in a lot of ways for, whether it's for public safety folks, health people, lawyers, trying to figure out what the authority is. I think, like any situation, if fire comes upon a burning building, they don't have to stop and call and say, hey, do we have permission to go put out your fire or anything like that. I think steps can be taken, but I know there's a lot of concern about closing businesses. At this point in time, I don't think we have the authority to say you must close. It's one of the questions that we're still looking at, because if somebody with a restaurant says, I don't want to close, can we go make them close? At this point, I don't think we can, but we suggest they do.
Thank you. And then nothing in here suspends anyone's rights? No, we're not suspending habeas corpus or anything like that? Okay.
No.
Thank you.
Mr. Mayor?
Christie.
Mr. Gridley, you see across the nation, we have governors that maybe haven't quite went so far as to shelter in place, but mayors that have. Would this emergency declaration give our mayor the ability to help people shelter in place if we needed to?
Again, I think we're still at a point of recommending that. So the question that we've looked at and don't have a definitive answer is if I should be home, I've been infected, should be quarantined, and I say, well, I don't care, I'm going to go out. What steps can law enforcement arrest me and put me in jail? There are questions I don't have the answer for you right now. Hopefully people will recognize the seriousness and will voluntarily take actions as recommended, but we can get an answer to you and law enforcement about that.
Thank you.
Other questions for Mike? So I hope I never have to use this. I hope to, and I think that through, particularly over the last week to 10 days, that the council has been very good about giving their input, and hopefully we've been good about getting information out to everyone. I hope I never have to make a decision, but I think what this does, two things, as Mike said, is opens up funding opportunities. This thing is changing by hour, every single hour. And if there's a serious decision that can be made and we have time to gather the council together and have a special call meeting, that's my preference. And that's what I would always want to do because, you know, we're a group here. We make group decisions. And so that is my hope. But if it comes down to that Troy comes into me and says, you know, we got to make this decision and we've got to make it right now, where I don't have the time to do that, this just gives us the ability to do that. Hope I don't ever have to use it.
No, it's very, very wise.
So if there are no other questions for Mike, we'd be looking for council action.
Mr. Mayor, I'll make a motion to approve resolution number 20-021, declaring a local disaster emergency.
Second.
Motion and second. Any further discussion? Roll call, please, Renata.
Wood,
Yes.
Evans,
Yes.
Miller,
Yes.
McEvers,
Yes.
Gookin,
Yes.
English.
Yes.
Motion carried. So I wanted to thank Laura. I've been in constant contact with Laura for the last 7 days straight, and for Chief White and Chief Gabriel and Deputy Chief Greif. They are working hard. They're busting their tails, and there's a lot of people. Sheriff Wolfinger and Chief Way, and so it is all hands on deck. And make no mistake about it, we're in a fight, and we're in a fight to save lives, and this isn't going to be easy. Anybody that says this is going to be easy is not telling the truth. This is going to be hard. And we must all come together. And there's been several times where we've had disasters where we've come together, but I don't think that in my lifetime we've never faced anything like this. It's an enemy that you can't see. So what we need to do is we need to follow all of our healthcare professionals' advice. That's where we need to go. And it's really not an option. We have to do it. And so we need to be calm and determined and dedicated that we follow all of our healthcare professionals' advice. The City of Coeur d'Alene is going to do everything we can to get the information from Panhandle Health, from the Department of Health and Welfare, and from the Governor's Office. And there's going to be some financial help that's going to come forward too for our small businesses and for our people that are going to be displaced out of work. And we're going to get that information out to everybody too. But the council and myself are determined to do everything that the City of Coeur d'Alene can do, and I really believe that together that we're going to beat this virus, and I'm very sure of it. So thank you all for the things that you're doing. So we will move on. A little bit difficult to move on, but we're going to move on, and we have, on a little lighter note, we have some special recognition, and Hillary, if you wanted to come forward.
Good evening, Mayor and council members. It is my honor to be here this evening to recognize George Ives for serving on our Design Review Commission for 16 years. So he was one of our founding members, and the commission has done a lot over the years. We've actually just recently worked on improving and streamlining the code, and George was part of that and really championed trying to make the process easier for all parties. So George was not only a founding member, but he has been the chairman since December 2007. So really wanted to thank him for his leadership and for volunteering his time and talent. And so on behalf of the Planning Department, the Planning Commission, and the other Design Review Commission members that serve with George, I just wanted to thank him. And we have a plaque that is for him, recognizing his 16 years of service. So
Could you read the plaque to us,
Well,
Hillary?
I
That's
would
what it
love
says.
to. The City of Coeur d'Alene proudly recognizes George Ives for 16 years of invaluable service with the City of Coeur d'Alene Design Review Commission, presented 2020.
Thank you.
I know, right?
George, you got to have a message for us. I will have to say that in 1979, George may not remember this, not that your memory is bad, George, but you were my Western literature teacher, and you probably don't remember me because I was not your best student.
You were mine too, George.
I think my grade might have been a C. I'm not a Western literature guy. Not that there's anything wrong with Western literature. Western literature is great.
Did have courtesy grades once upon a time, but well, thank you so much, Hillary, and thanks also to the wonderful staff that you've, as a council and mayor, have put forward over the years. I had the pleasure Hillary said, of being on the team with the previous Director of Planning, Mr. Yaden, and a consultant from Seattle, and we came up with some things that worked pretty well, I think, to initially get the process going for the planning of the community and making Coeur d'Alene a place we can all be proud of, which is always the goal, to let people know what's going on and get them involved in the process. And as we work with different members within the community, builders and members of the public, we've had some very contentious hearings, and that's always been not always fun, but it's always been productive because the exchange of views lets everyone get a clear sense of what's taking place. And as we've refined that process a little bit, and that will be coming to you shortly, I'm sure, for some modifications on the regulations. The staff has been, as I say, excellent, and the members of the commission have been very cooperative in doing things. So thank you so much for allowing me to be a part of the planning of Coeur d'Alene for the foreseeable future, at least. I hope that I'm around to see it for quite a while. At least I hope I deserve a great equivalent to our mayor.
Thank you, George. Appreciate it. So now we will go to our public comment portion of it. Anyone wishing to come up to give public comment can do so. And David and I spoke before the meeting, and David said, David's attorney, remember? Now, and so he asked me if he had a couple more minutes.
I might go a little long.
Oh, okay.
I'll make it as
I'm okay, David.
I'll make it as fast as I can.
Yeah.
Midtown restricted parking. It's on tonight's agenda. Hillary's survey about Midtown parking got answers from 39 people. I'd like you to focus on a few key questions and answers. 24 and 25 were directed to visitors to Midtown. That's patrons, employees, et cetera, of the businesses. Question 24, are you aware of the public parking lots on 3rd and 4th Streets? 25 people answered this question. Yes, they're aware, 24. No, 1. Question 25 to the visitors. How often do you use the public parking lots on 3rd and 4th Streets? Same 25 people answered. Always, 0. Most of the time, 5. Sometimes 9. Rarely 5. Never 6. So out of the 25, all of whom know about the parking lots, out of the 25, 20 say they sometimes, rarely, or never use them. That's the fundamental problem. People know about the lots. They don't use them. It's easier to park on the side street than walk a block or so. That's why you adopted restricted parking in Midtown. Has it worked? Questions 7 through 15 are directed to the people who live on those 3 blocks, the program participants. There are 7 occupied homes on those blocks. As I understand it, all 7 homes signed up. Question 8. Has the signage, that's the signs up there that say permit parking only, has the signage prevented non-permitted vehicles from parking in front of your property? 10 people answered, 2 to a few households. 10 people answered, yes, the signage has done that, 8. No, 2. Question 10. This is during the program while it's been in effect. Have you had trouble finding parking in front of your home within the designated parking zones? 9 people answered. No, I have not had trouble. 8. Yes, I have. 1. Question 13. Has the program changed the parking situation in front of your home? 10 people answered. Better, 6. About the same, 4. Worse, 0. And question 14, would you renew your permit if the program was extended? 10 people answered, yes, 6, maybe 1, no, 3. So I submit that when you ask the people directly affected by this whether the problem's been fixed and whether the program worked, I think the answer is overwhelmingly yes. There was some comment in the staff report about opinion being mixed or uneven. That was in response to questions to a broader audience. If you include, say, the employees and the patrons, well, we know they didn't want restricted parking to begin with, or they're not crazy about it. But if you focus on the 3 blocks, the residents of the 3 blocks involved, it's overwhelmingly worked and overwhelmingly popular. The staff proposal you're presented with tonight would continue restricted parking until all the improvements and expansion that are planned for this summer, until all that's been done. And then it would end. Then restricted parking would die. That's a bad idea, I submit, because it assumes that the new parking lot improvements and expansion will work to fix the fundamental problem, the problem reflected in questions 24 and 25, that people don't use the parking lots because it's just easier to walk a block, or to walk, they don't want to walk a block, it's easier to use the side street. We don't know whether the parking lots will work to do that. I hope they do. I wouldn't bet on it. In fact, I'd bet against it. If they don't work, and as this proposal tonight would have it, restricted parking is dead, then we're back where we were a year ago. People don't bother to walk a block, to use the parking lot. It's just easier to use the side street. So what I'd suggest is that you continue the restricted parking program, just a minute or two, Renata. Continue the restricted parking program until, say, 60 days, a couple of months after all the improvements and expansion and everything has been done. And we have a chance to see whether the improvements work in actually drawing people in to use the lots and in changing those attitudes that we see reflected in questions 24 and 25. If they work, great. But if they don't, and restricted parking goes away, we're back to where we were. So give it a couple of months after all the work has been done. By that time, the Butler project will be pretty well done, and we'll see how that plays into it, and see whether they work. There's no need to decide this tonight. I'm asking you to just keep an open mind and not prejudge it tonight. Wait 6, 8 months, whatever it is, use the benefit of that experience and what you learn over that time and decide then. Excessive calling by one person to the police is bad and it has to stop. I completely agree. That person, I'm told, now swears up and down that it will stop or it has stopped. Well, that remains to be seen as well. You can revisit that issue then as well. Infill development, which is what we're talking about here, trying to shoehorn new development into established areas. It's difficult. It's not easy. It's not like putting 100 new homes out in the prairie where there's nothing but trees and fields. Half a block east of 4th Street, it's all single-family residential. There's going to be problems. There's going to be conflicts that need to be wrestled with. So in the Midtown Infill Overlay Ordinance, which you adopted and which is the law of the city, Code 17.07.900, the city promised it would encourage development, quote, while protecting the surrounding neighborhoods, unquote, and that you would pursue, quote, a sensitive form of development. It said, you said, protect the surrounding neighborhoods, not protect the local businesses. Of course, there's a conflict between the neighborhood and the businesses. That's the nature of infill development, when you're trying to shoehorn new growth into established areas with neighborhoods right there. Protect the surrounding neighborhoods. That was a promise you all made to the neighborhoods. That's a duty that you all undertook. So all I'm saying tonight is leave open the issue of restricted parking and when it ends. Don't decide it tonight. Keep an open mind. Let the construction and improvements get done. Give it a couple of months or so afterwards to see whether they work in changing people's behavior, and revisit the whole situation then. Not tonight. Thank you.
Thank you, David. Others for public comment? Come on up.
Good evening, Mayor and council members. I'm Bob Small from Lake City Center. And I just wanted to update you tonight on some of the things we're trying to do to continue serving the most vulnerable people in our community. And one of the things we've done, well, every day at 6:30 a.m. we start sanitizing and cleaning. And at the end of each evening, we go through the same routine again. And we have continued our congregate meals, but yesterday we wanted to try something that would help others that want to continue distancing themselves and following the edict from the public health department. And so what we did starting today was something very innovative. We actually opened a drive-through where they can come in, they just drive in, and the hot meal of the day, today was corned beef and everything else with it, we actually then serve them in their vehicle, and off they go. And that's gone over very, very well. We had 17 people drive through, and that word didn't even get out, except for the Coeur d'Alene Press. We owe them a lot of thanks, because it did come out in this morning's paper, and like I say, we had 17 calls. We've had numerous calls all afternoon from people saying, this is a wonderful idea, and we're going to be back. And we'll start coming and going through the drive-in. It's, of course, taken a hit, financially, like a lot of businesses are. Our bingo, we actually canceled that last night. We are considering bingo again Thursday night, but we'll see. The turnout was just, 6 people, and it wasn't viable to continue. So that, amounts to about $2,000 a month in income for Lake City Center. So that's gone. But we'll continue, and the tax aid program has been interrupted for at least 2 weeks, and that was based on AARP nationwide saying, okay, we're going to stop that free tax preparation service. And we've had a hard time even fielding the phone calls from people that are, desperately trying to get in to get their taxes done. But we understand that this is something we all have to, take very seriously, and we have. One of the other things, you probably, some of you have some, better connections than I do. I spend about 2 hours each evening trying to find ways to get more hand sanitizer, to get more wipes, et cetera. But one thing we could use, right now we still have, plenty for anybody that walks in the center. But are those, and I used to order them as an HR director, and that's the Purell touchless, they're on a stand, dispensing foam. And if anybody has any connections, we could sure use a couple of those at Lake City Center. And again, the feedback we're getting from the community is fantastic. In fact, we got 2 cards today from people who actually drove through and picked up a meal. And they took the time while they were waiting in their vehicle just to say, thank you, you're angels. It's wonderful. And the first gentleman that was there, 92 years old, and he still drives, and he said, I just got off the phone with my daughter in California, and she says, don't you dare go out and eat. You can't do that during this crisis situation. And he said, well, I'm not going to go out and eat. I am going to go out and drive, but I'm actually going through the drive-through at the senior center, and they'll deliver my meal. So that's what we're trying to do. We will consider coming up with innovative ways to serve the seniors and make sure they get, they're continually being served. The other thing I want to bring up and mention too is the Meals on Wheels have not been interrupted yet. We still have, thank God for our volunteers. They're still coming there to make sure that 110 meals are distributed every day in this community to the homebound and disabled seniors. And we're extremely proud of that. So that way, at least we know that those 110 people, and it's going to go up, are getting a hot, nutritious meal. And we're very proud of that. We'll continue to keep working on that. And like I say, the feedback from the community is fantastic. So any help we could get from the city council would be appreciated. Are there any questions?
Thanks. Thank you very much.
Thank you all.
It's very important, the things that you're doing. Thank you. Anyone else wishing to come up for a public comment tonight? Okay, we will move on in the agenda. Woody, you got the consent calendar?
I think I do, boss. I'd like to make a motion to approve Resolution 20018 declaring, whoops, I'm ahead of myself.
Yeah, that's been done.
I drifted off, sorry, boss. I'm almost there. How about a motion to approve consent calendar as presented? That was easy.
Second.
Excuse me, would that be including resolution
And
number
including,
20-017?
Thank you, guys.
Second.
Motion and second. Any discussion on that? Roll call, please, Renata.
Evans?
Yes.
Miller?
Yes.
McEvers?
Yes.
Kukin?
Aye.
English?
Yes.
Wood?
Yes.
Motion carried. Now, announcements. Any member of the council have an announcement tonight? Kiki?
I have two. The library, as you may have heard, is closed. They are still doing curbside pickup for books. I don't know how long that's going to continue, but you can request a book to check out online. You don't need to bring your library card, and they will have it ready for you when you drive up, so there doesn't need to be any contact. So those of you who are at home with kiddos and you need more material, the library is still doing that. The other thing is, separate from Corona here, I've been involved in discussions with Coeur d'Alene EDC, U of I, some other venture capital professionals regarding applying for a capital challenge grant. And this group is they've agreed to move forward for a preliminary submission. And if that moves forward in June, they'll put a final request in. If that grant would be received, what that would do is it fills kind of a niche in the community for education and resources for both potential investors and startup businesses, with possible future financing mechanisms for regional venture capital and/or angel funding organizations. So I have spoken with a couple of city members about that. That's just something in the future where we may have a new resource in town to maybe help us recover from what we may be going through right now. So I wanted to let the rest of council know that I've been involved in those talks.
Great, thank you. Appreciate that. Anyone else have anything tonight? All right, we'll move on in the agenda. We have resolution number 20-018, declare CXT Precast Products, Inc. as a sole source provider for the purchase of a customized modular restroom to replace the Bricks City Park restroom. Bill Greenwood.
So this is Councilman Gookin's favorite topic, flush toilets.
No, brick toilet? Brick toilets.
So this is a follow-up to a meeting that I attended a while back, and you asked that I would bring back to you the design of a restroom facility that we're going to put in at the north end of City Park to replace the bricks. And so this is what it looks like. This is a precast concrete building. We have one of these at Landings Park, not quite this large. It's pretty bulletproof. We don't have much vandalism that we can't take care of in this unit that we have at Landings Park. We chose this color. We thought it would fit very well in the park, and this motif on the rock as well. Just a couple different views of it. The last slide I'll show you is the layout of that, which will include for girls softball changing rooms. And that's the layout. The changing rooms would face north towards the grandstands. 2 separate changing rooms for both teams. Ladies' room and men's rooms each have 5 commodes in them. This is the maintenance chase to service those facilities and a custodian's closet to keep in supplies.
So Bill, does the changing room have direct doors into the
Correct.
restroom?
There's a door on east and west, correct. Right here and here.
But not directly into the restroom, though?
Correct. They're separate.
Okay.
We asked for that just so that they weren't part of this, because these will not be used except for, we don't plan to use them for our programming. It'll be strictly for NIC's games. Doesn't mean that use wouldn't change some, but currently that's the way we're seeing it.
Okay. Questions for Bill on this? Christie?
Comment, Mr. Mayor. Thank you. I'll change hats for a minute. Bill's just been fantastic through this whole process. I've been kept up to speed because I'm on Park and Rec. But also just on behalf of NIC, really like to commend you for your work and thank you for this. This is going to be a life changer for our girls' teams, and appreciate that this is going to come on board pretty soon.
Thank you for the kind words. But we're partners with NIC, so it's a good thing for everybody.
Dan?
Thank you, Mr. Mayor. So, Bill, we're replacing the facility because, I mean, I know it's a public restroom, and
Right.
usually the bar is low on those.
So, well, you stopped me earlier, and I thought it through, and so I appreciate the heads up, because I didn't really have an answer for you at the moment, but it occurred to me why this was a higher priority. After we had to retool this when we were over budget, if you recall, and we had to pull out all the insides to make budget. We did all that, went through that gyration, and made those changes. And then it came out, well, gosh, by the way, we have a problem with Title IX. And so we were considering trying to put up maybe a separate facility that was like a trailer of some sort for a changing room in the parking lot over by the carousel. And so with that being said, we found some funding to redo this antiquated restroom. And so that's why the changing rooms are in there, and for that reason, that became a higher priority.
Title IX,
Right, that's what I was told from NIC.
which is what?
Well, they had to have these separate changing rooms for other people that may want to be in there, that maybe their gender is in flux. I don't know how else to put it.
Oh, so it was that.
Correct.
What I asked Bill earlier was that we have talked about the restroom at Person Field.
Correct.
And how that, in my opinion, was even worse off than the restroom facilities in City Park. And it just seems kind of, to me, and to a lot of people I talk with, that Person Field kind of gets pushed to the back of the line. And that here's downtown again, it's, everyone, we like downtown, and we're putting in a new bathroom there, whereas I think Person is really due. So to answer those people who are concerned about Person Field and the bathroom, is there anything you can offer?
Well, I think we can certainly look at it this budget year and see what we can do to fund another facility at that site, at Persons Field.
Okay.
Mr. Mayor?
Yes, Christie.
And if I could respond to Councilman Gookin, well, and I'll clear up Title IX. That's just essentially females are given the same opportunities as males, and that we are required to do that by law. Same kind of facilities. This entire project came about because NIC provided a $150,000 check to the city to focus on the memorial grandstands. This was all going to be part of the grandstands, the changing rooms. And then that entire thing changed. You still had our $150,000, which was fine. We're happy to give that to the city. And Bill and administration and the mayor got busy looking for other ways to accommodate that partnership, and that's what this grew out of.
All right, I see, okay, that makes sense. I
And
just,
if
you know, I get a lot of feedback, because people, you know,
Right.
there's a chip on the shoulder. And
Sure.
understandable, and,
Right.
you know, and I've used the facility at Person.
No,
and
it's shabby.
I've used the
I'll
one-
give you
yeah,
that.
I've used the one downtown too, and I was just, it struck me, and now that I have the more information, and I hope people are listening and paying attention. But there is, I mean, something's gonna happen for Person. I mean, I know you are
Yes.
paying attention to it.
Right.
And so, eventually, the facilities will be upgraded.
There's a lot of changes that can go on at Persons. We just haven't found the funding. There's some additional parking that we've talked about along Garden. There's also some area in that southwest corner that we talked about. There's a master plan, if you recall, that we brought forward several years ago, how it showed about 22 parking stalls inside there. The replacement of the restroom is one of those. We have to work with the grade there for ADA, so we've got some things there. And this unit might work really well there by just excluding these changing rooms, and have something like this at Persons would work really well. The other thing about City Park is, additionally with Title IX, it also had some ADA issues. You know, it was very difficult. Those doors were a little narrow, and the foundation was settling to the degree that we couldn't really open the doors very easily. It took quite a bit. So someone in a wheelchair or had some difficulty walking would have some hard time getting through that. So it just kind of rose, you know, to the top of the need, but I've never forgotten Persons.
Thank you.
Any other questions for Bill? If there aren't any other questions, we'll be looking for council action.
Okay, well, I will move to approve resolution number 20018, which is declaring the CTX Precast Products Incorporated as the sole source provider for the purchase of a customized modular restroom to replace the Bricks City Park restroom.
Second.
Motion and a second. Any further discussion? Roll call, please, Renata.
Miller,
Yes?
McEvers,
Yes.
Gookin,
Yep.
English,
Yes.
Evans,
Yes.
Wood.
Yes.
Motion carried. Thank you, Bill. The item number 1 on other business, the ground disturbance permit program, has been canceled for tonight's meeting and will be rescheduled at some time in the future. So we'll move on to the Midtown Pilot Parking Program 1-year review. And we have Hillary Anderson. This is for resolution number 20-019, which would be approving the extension of the Midtown Parking Pilot Program. Welcome, Hillary.
Okay, great. Well, thank you. So really, this evening is just a report back to you on how this pilot program has worked over the past year, and then to seek direction from council on if and how the program should be continued. So a little bit of history. So if you recall, I was before you. We had a couple of presentations leading up to this, but last year at the April 2nd meeting, council did approve by resolution just to have this pilot program for the Midtown area, and just on certain areas that were established in the resolution. I'll show you on the next slide the map for that. The program did require 66% participation on each of the 3 blocks. We did receive that. And right after the resolution was adopted, signage was installed by Streets and Engineering on the affected blocks to indicate it was the pilot program. A little bit of work was required, some fine-tuning, additional signage, some flags, things like that, just to make it a little more visible. But that did begin right away on April 9th, and then the vehicle tags were also sent out right away. So as noted, 6 homes are participating. Each home can receive 2 of the vehicle tags, and so each of them received that. It's similar to how it is in Fort Grounds for how we were going to administer the program. So the boundaries are on this map here. The streets are just portions of Montana Avenue, and as you can see here, it's on both sides of the street, east of the alley, so in between the alley and 5th Street, East Roosevelt, just on the south side of the street. Here's Capone's. And then on East Reed, so between 4th and 5th Streets, just on the south side, east of the Midtown Loft. So it's east of where that parking lot is. So a little bit of the financial analysis, just so you recall, and so community members are aware. We looked at different options for enforcement. We looked at Diamond Parking, since they do a lot of the parking enforcement around the city, and just because they were really daytime only, it didn't make a lot of sense. And since in Midtown, a lot of the issues were in the evening, at night, and on the weekends. And so we also looked at Northern Security to see if that might be an option, because they do patrol for us in our parks. But in looking at their numbers and kind of estimating patrol times and whatnot, it was going to be about $3,000 a month. I apologize. So very expensive when we're really 6 homes, $30, and looking at $180 are coming in. So we did determine at that time that it made the most sense for the police department to do the enforcement, and obviously recognizing that priority calls would have to take priority over this program. So performance analysis, so some things have changed. So, in addition to the public parking lots being used, obviously there's some improvements that still need to be done to those public lots, but they're being used. And the city also worked on acquiring the additional residential property on 3rd Street with the plans of expanding the parking lot off of 3rd Street. We have a commitment from Ignite CDA to purchase the lights for the public lots, because we know we're going to do improvements, we're going to repave, we're going to stripe, we're going to add the lighting and new signage as well. And so we have a commitment on that, and we have bids for demolition of the home on 3rd Street. So we're ready to take action and improve those public lots. That is a priority, and it will be done this year. And so just wanted to make sure that everyone was aware of kind of the timing of that and the priority. We also did add onto the city's GIS mapping, we added the Midtown parking lot. So we have that mapping layer so people are aware where the lots are. And then Trinity Lutheran also did add the option for the public to park in their lot. So they're working with Diamond Parking, and so that's new. Before it was kind of restricted just for any of the members of the church or any visitors, and so now that is an option as well. So some things have changed. We also have added the rectangular rapid flashing beacons on 4th Street, which does help with the safety and allowing people to feel like they can park in the public lots, and then go to businesses that would be on the east side of the street. So Midtown Development Project, so some updates on that as well. So Ignite CDA selected the Midtown Ventures LLC project for the property that is just north of kind of the Capone's area where the junk building was formerly, where we have the Green Pocket Park, and then the Paris Flea Market. So that kind of location right there, adjacent to the public lots on 4th Street. So their latest concept was presented to Ignite on the 19th of February. They have scaled it back quite a bit. They actually removed the top floor, and they've changed the number of square footage for commercial uses and the residential count. So on the screen, you can see the latest count. So we're looking at 25 apartment units. One of those will be on the ground floor to meet the ADA accessibility requirements. This commercial now will be under 5,000 square feet. And then they have added some additional parking as well. So they would be required, as you can see on here, the 33 parking spaces, and they're actually providing 53. So that's also a bonus, so they're not going to be relying on the public lots or the neighborhood streets. And then they are also including that green space. That was a priority of Ignite CDA to include. So it's about 5,200 square feet of green space. So this is the site plan. So you can kind of see, here's Roosevelt. This is North. And then they have the 20 spaces in this parking lot. So a reconfiguration, expansion of what's there now. 33 spaces behind, they're both accessed off the alley. And then the building will be here fronting 4th Street, with the green space to the south. And then these are the public lots. Here are some elevations from different viewpoints, kind of looking at the building, looking northwest, looking north, and then this is looking from the alley, kind of northeast, so you can see the parking at the rear. So I will cover some of the survey results. I don't have all of the survey slides here, but if you had any questions, I have that as a separate file that we can open if there's any questions. So as you heard before, there was about 39 people that participated in the survey, a mix of residents, and that was residents participating in the pilot program and residents who were not. Patrons, we had organizations, businesses, and then we also had other, and that the people specified what they were. So that was people that had either they lived in the Midtown and they worked there, or they lived in Midtown and they were patrons, so they felt like they were in more than one category. So overall, this was for all of Midtown residents, not just pilot program. It was really tied on, has the pilot program improved or impacted their ability to find on-street parking near your home? And so about the exact same number said it's improved, and it's the same. and then we had about 25% say it was worse than before. So as I noted in the staff report, there is kind of a mix of results. I think some of the residents that are in the pilot program, most of them felt like it was improved. Some thought not significantly. But the streets are for the public as well. And so we do have the patrons, we have the businesses and visitors of the Midtown area that also use the streets. So the survey was not just for the pilot program because we want to see the overall impact. How does it affect everybody? And so this question was also for Midtown residents who are participating in the program and asking them how it has changed the parking situation in front of their homes. And so as we would expect, they would say it is better. So we heard from 60% that it was better, and 40% it's about the same. This one is again for the program participants, and this is how often they had to report violations to the police department. And so you can see varying levels of having to contact the police frequently, infrequently, and then a few that said they never did. This is for the Midtown patrons and visitors, finding out how the program has impacted their ability to find parking near their destination. And so you can see here it's slightly worse, or it's quite a bit worse, I should say, and then it's about the same. It's kind of, those are pretty close together in terms of the rankings. Some said it's better, and then some said they're unsure. This is for Midtown businesses, institutions, organizations. How has the program impacted your patrons and members' ability to find parking? And this is very resoundingly, it is worse than before, so almost 80%. For the same group, we asked them how able they were to easily find parking within walking distance of their destination, and the highest response was sometimes, so 50%. And of course, this is, there's all the different businesses and organizations there, and so it really depends on where people are going to park. So you heard earlier that, people are always wanting to park on the residential streets. That's not necessarily true. Sometimes they might park on 4th Street because there's available parking, or the public lots, sometimes the side streets. Midtown businesses, institutions, organizations. Has the program caused issues and complaints from your employees, patrons, and members? And this was resoundingly yes, so 60%. Same group, how often do you use the public parking lots on 3rd and 4th Streets? And this was the sometimes and then most of the time were the kind of the highest responses there, with, I guess, never is really the 25%. But if you look at most of the time and sometimes, that's kind of it's a pretty big response for participation, so over 65%. So we wanted to find out why people are using or not using the public parking lots. And so there were this question and the next question. And so really, as you can see on this one, why they're using it is the convenience. So again, depending on where you're going in Midtown, if it's convenient, you're going to park there. And so that was the response. There's a typo here. It should have said the parking lots are well lit. We didn't hear that that was the reason people are parking there, nor that they're well signed. But I think the convenience is the biggest factor. And then some people thought, all the above, we're fine. We don't mind how it's lit or signed. And this is why you do not park in those lots. And so, again, depending on where you're trying to go, some people thought it's not convenient, because if you're trying to go somewhere else in Midtown, you may not choose those parking lots. And then we heard also that maybe they're not as well signed as they could be. We know that. And then oftentimes they're full, and that is true. You can see that some of the businesses do get a lot of use out of those parking lots. So we did ask everyone, how well do you think this program has been working? So if you're aware of it, how has it been working? And the majority response was that it's working poorly. And so again, this is all users. This is the people in the pilot program, organizations, businesses, institutions, patrons, and visitors. And then everyone, what was your opinion of the resident-only parking program? And if it should be continued, modified, or terminated? And this had the exact same number of responses: to continue it as a pilot program or to terminate it. So as you can see from staff perspective, we're kind of looking through the results, and it's not a win-win. It's not a perfect program. And so that's why we have the recommendation for you this evening. Now, I did have also wanted to talk to you about kind of the police department's stats. And so I'll present to you what we'd received from Chief White. He's here as well if you'd like to hear from him on any other updates on the program and how it affects their enforcement. But the area did receive a lot of calls. They received 40% of all of the calls citywide related to parking, just in this area and just on one street. And so from the police department perspective, that's a significant drain on resources. And it's concerning if the program was going to continue either as a pilot program or in perpetuity, that we could expect a similar drain on resources. So these are the numbers that we heard from total calls for the whole city, total calls from the area, and then that also resulted in follow-up calls from the individual. So our recommendation, just given the Midtown Ventures project, given the timing of the public parking lot improvements, is to extend the pilot program until those lots are improved, or if council has other guidance for us. And then also, if there are any suggestions you'd like to make for our plans to improve the signage, we could do that as well. And so we are looking at improving or changing out the signs, so once the program expires, looking at changing from what's there now, so you can see on the left, existing signage, with something that's similar to what's on the right, saying it's congested area and directing them to the public parking lots, which are a block away on 3rd and 4th Streets. And then the Streets and Engineering Department is also currently looking at 2 parking signs, one for each of the entrances of the 2 public parking lots that would be backlit. They would be similar to this P that's in our new parking structure. And so they would be blue with a white P backlit so that they would be visible at night. And then, of course, there's interest in doing some more creative, artistic, visible signs as well for the public lots. But that's the plan at this point, and so decision point before you is to provide direction to us on how and if the program should continue, and you have the resolution in your packet if you wanted to extend it, or if you have other guidance for us, and then, again, on the signage plan. With that, I'd stand for any questions.
Thank you, Hillary. I had a question on, there was a survey response from the people, the permit holders, right?
Yes.
And if I understand Mr. Lyons' number, it was 6 would repurchase.
Right.
1 was neutral, 3 would not.
Correct.
Do we know who the 3 that were not in
I
favor
did
of that?
not dive into that, but I certainly could. When we did the survey thing, it was anonymous responses. We could certainly try and go back and figure out who.
I think that might be important moving forward, because if there are 3 people that do not want to be involved with the program, now,
Right.
there would be a little bit of conflict if they were right next to each other, right?
Right, absolutely.
But if there are, let's say that they're on Roosevelt or they're on Reed, if those people on Roosevelt aren't interested in it,
Right.
then they don't have to have it.
Mhm.
So I don't think we want to force a residential program onto someone that doesn't want it. Now, there's a conflict there when you have, like I said, neighbors.
Right.
But if we could, maybe do some research to see if we could find out who those 3 people that don't want it, and the other one that is, doesn't really matter.
Right,
So-
exactly,
so
that there's no
4.
change.
Yeah. So council questions for Hillary? Christie?
Mr. Mayor, thank you. And I'll actually address Mr. Lyons too, if I may. Mr. Lyons, I'm new. I had to get caught up to speed.
You can go ahead.
Yeah, you're
No,
fine.
Yeah, you're fine.
And I wanted to learn about this entire program and what the council has done, and it's pretty clear they're interested in solving the issues in Midtown. They've been working with the neighbors. And I'm open to your proposal. But I also want to tell you a little bit about my background, which is 26 years with the police department. So I'm well aware of the kind of calls for service that are a priority, and I think you and I agree.
No argument on that.
And I'd like to tell you, thank you for coming out on behalf of your neighborhood. I hope they appreciate you. But some of the calls that they need to be educated on that are high priority, child abuse calls, domestic violence, all these issues that the police department is being torn away from. So what I would like to propose is you take a message back to them that it is intolerable to go on with that kind of a call load.
I could not agree more.
Yeah, so, anyway, we can't have any back and forth,
Yeah.
because Kay can't hear you, so.
Thank you.
Yeah.
And if it were to continue in that way, I think council will be forced to shut down a pilot program. We couldn't possibly allocate resources on an ongoing basis for 3 blocks in the city. So that is my perspective. I'm open to your suggestion, and I'm sure council will debate that.
Could I speak? Just-
Yeah, well, I think council has all the information that they need, David. Yeah. Amy, did you?
I have a question for Hillary and maybe Chief White. Have the citizens who have been making these excessive calls, have they been coached that it's crossed the line of appropriateness?
Yes, it's my understanding that they have, but I believe there have been additional calls since the coaching, and that would have to be, Chief White would have to respond to that.
Chief White, did you want to come up and respond to that?
Good evening. I just want to make sure I understand your question. Your question was whether or not we've spoken to the person who's made the excessive amount of calls to let that individual know about the inappropriateness of them or the volume of them, or?
Correct, that they're taking away resources from the city, from other calls that may have higher priority. And if you did have that conversation with the individual, did the calls cease or did they continue after the conversation?
That conversation was held a whole bunch of times, and the calls continued. My understanding is they've dropped off dramatically since a particular council member had another conversation with that individual. But in 2020, as of March 11th, we've had a total of 85 parking calls throughout the city, and 23 of them still came from that same individual. So they continue. And really, some of the problem is, and it was part of the presentation previously, that Diamond couldn't do the enforcement because it was after hours. Well, after hours is when we are at our busiest. And so oftentimes it is taking away from other more proactive activities that we would historically be engaged in.
Okay, thank you.
Follow-up to Chief White.
Yeah,
Mr.
Chief,
Mayor.
I think that Dan has go ahead, Dan.
Thank
Yes,
you,
sir.
Mr. Mayor. Are you telling me that since, and I'm the council person who met with this individual, that the calls have continued?
My understanding is that since from January 1st to March 11th, there were a total of 23 calls. 14 were specifically from that one individual, and I don't know the data when you talked to her, so I don't know.
The end of January.
The data I have is from March 11th. I don't know exactly what the dates of the calls were made.
Okay, so theoretically, the calls could have stopped, but we don't have that specific data.
They could have, yes, sir.
Thanks.
Council have any other questions for Chief White? Woody?
Oh, no,
Oh,
I'm sorry.
okay.
Chief, you're on it.
Hillary, I guess you're up. Woody, you got some questions?
Just, so the surveys are just a cluster, no offense. There's just stuff all over, and we're trying to draw conclusions within 10%. The one about, did they like the pilot project, and you had 35 responses, but only 7 people are impacted. I didn't quite understand if the 7 people who have the homes that have the signs that are impacted by people parking in front of their house, where does 35 responses, where does that come from?
So
How
there
does that
were
justify?
39 people that participated in the survey. So if you look at that section of the staff report, let me see if I can find the breakdown. There were 17 were residents. 4 were business owners or managers. 1 was a member of a Midtown business, institution, or organization. 13 were patrons of Midtown businesses or visitors, and 4 were others. And those others were both residents and patrons, or downtown residents, nearby residents, and their family lived in Midtown. Right. So
Okay. No, I get it.
Midtown
I'm just-
stakeholders.
So I'm thinking, who would not like it? Would be anybody who doesn't live there.
Right.
Patrons, business people. I
It
want to
could
park
be
in front
other
of your-
residents not in the pilot program, because maybe
Right.
they have additional
I guess I'm
cars in
not
front of their homes.
following. I might just be out there today, and I'm sorry, Mayor, I'm drifting here. But it just, it seems like we did this to help those 7 or 8 houses, like we did over on the NIC side. The kids were parking in front of people's houses, I know, during the day. And so by doing that, they stopped parking there and parked in the parking lot, which is kind of the essence of what I think we're trying here to do, is use the public parking. But I see that downtown, too. We go through that have to move every 2 hours, they aren't parking in McEwen and hiking in or using the facilities. So I'm not quite sure if, are we still on the same page to help those 7 people not have people parking in front of their house? That's kind of the issue, isn't it?
Yeah, and I think that's where we're at now. We are embarking on a program to build a new parking lot, to have new signage, to have more lighting, to create the whole program, a better parking program up there.
Correct.
And will that cause people to not park in front of the residential?
Right.
So I guess that they're bringing forward that we are going to extend the pilot program up until the time that we get all of the parking completed up there. So all of our parking, and what Mr. Lyons has said is that he's good with that, but Mr. Lyons said that he recommends that we take a 60 to 90-day look after it's completed, continue the parking program for 60 to 90 days to see if the new parking lots are effective in reducing the people that are parking in the lots.
I guess it's interesting to think about who is the unhappy people, everybody but the people who live there. And I find that rather interesting to try and balance that. Wait, who are we trying to take care of here? The reason was somebody's parking in front of your house all day going to work, and you're going, I want to be able to park in front of my house. That was the initial.
And even the survey said that there were one that was indifferent. One of the residents was indifferent. I shouldn't say one of the voters was indifferent.
Right.
The number of votes is greater than the number of households. Is it 6 or 7 households?
There are 6 participating, and then
So-
there could be 2 permits per household. I'm not sure that all homes are
14
using
all day.
both.
Okay.
So more than like, so if there are 4 people that said that they didn't, 1 didn't care, and 3 didn't want it,
Right.
you could assume that that's either 2 or 3 places.
Right. Half.
We're making a lot of assumptions.
Mr. Mayor.
Christine?
And on another one of the survey answers, the residents really understood that this parking issue is not critical, and you don't need to call the police all the time. And so they would go out on their own and ask people, remind them, this is permitted parking. And I think that's fantastic. They were doing that. We should encourage more of that and help them understand. There's only a few times when it's proper to constantly call. Well, you shouldn't be constantly calling unless it's an emergency. But certainly you can resolve a lot of issues on your own. And only if someone's parked in blocking your driveway, or you're feeling threatened by approaching someone, or you've got a car that's been there for a few days that's clearly not moving. Other than that, there shouldn't be these constant calls to the police department. It's just, it sucks up valuable resources, and you all know that. And so I'm open to his proposal of waiting until after the parking lots are in place and determining how the program goes. But the education, if people are constantly saying the same thing, which sounds like the chief of police has constantly addressed this, we may be forced to not continue, and I don't think any of us want to do that. So,
Dan?
Thank you, Mr. Mayor. The impression I get is that the neighbors want the program to continue. And I explained to one person in particular that once the parking lot comes online and it's signed and it's well-lit, then I think the problem will diminish. But what they really wanted more than anything was, even if we abandoned the program, was the signage. And I don't know if you want to bring the suggested, which I like the suggested sign, just because they said the signs really helped. And once I explained about the resources and that, you can't keep chronically calling the police, that was understood, but the signs were important. So I think even if we do extend it to when the parking lot comes online, if we still have the signage, and I think that's what your proposal is too, is to take down those restricted neighborhood signs and then put up the congested area signs, and hopefully that continues people. And besides, I think once the parking lot's in and it's well lit and has some fancy art up there, some like light up art, I think people will naturally gravitate to the, just like they do in the foregrounds. I haven't spoken to all my neighbors, but I know on my street, the parking is not as bad since the education corridor came online and all the parking became available. So hopefully that fixes itself here. but they don't want us to abandon it, they want to continue, and I'm pretty sure there's not going to be any more calls, I mean, unless it's an emergency. So I think that message was really well received.
Amy?
So, I'm uncomfortable with the drain on the resources and us possibly extending the pilot project when it is significantly impacting one of our, crucial departments here, especially during this time. I understand, Dan, and I appreciate that you went and visited with the citizen, but I'm not reassured by that. Is there I just want to put out there, if we put up the sign, the congested area sign, it still will be parking by permit only, though?
No, this would be once the
Okay.
permit program either expires on its own
Got it.
naturally at the end of this month, or if it's continued, that then the signs would be changed out.
Okay, thank you for clarifying that.
Welcome.
Other questions? Kiki?
Well, my thoughts are, this was a pilot program, and that means it's a test program, and that's why we're reviewing it at this benchmark. And when you have the actual participants, and it wasn't unanimous that they all would redo their permit or even wanted the program to continue, that doesn't tell me that it's overwhelmingly successful. And it feels to me that we have spent a huge amount of time, resources. I think there's a lot of things skewed here with one person overwhelming the calls and changing that, percentage and creating, an issue where there shouldn't have been one. But I think that canceling the program when the public parking lots come online makes the most sense. If there are signage, there is now a habit built. People who work and live in that area know that there was permitted parking there, so they're going to be more amenable to going to a different area already. There's been a pattern created. I think if you have a pilot program and you keep piloting and piloting and piloting, you're just not doing what you said you were going to do. So I feel like the work has been done. It wasn't a unanimous, overwhelming success. There's conflict even within the homeowners, whether it's doable or not. So I think my feeling is we did our job. We fulfilled what the request and tried this, but it's been an overwhelming amount of study and work, and it's not a unanimously wildly successful program.
Any other questions or comments for Hillary? If not, we'd be looking for someone to craft a motion.
Mr. Mayor, I'd like to take a stab at that. So I'd like to move to approve Resolution 20-019, which is approving an extension of the Midtown Parking Pilot Program until improvements are made to the Midtown public parking lots plus 60 days.
I'd second that.
Motion and a second. Further discussion? Dan?
And so I'm incorporating what Mr. Lyons suggested, so the parking lots come online, we do 60 days, and then, to my knowledge, it ends. So then it's over, we change the signs out, and the pilot is done. The parking lot is online. I think that'll address the issue. If it doesn't, we are the city council, we can make the decision again. We get a majority of people to come back and tell us it's a problem, we can look at it again. And I think that would be, in my opinion, the best approach. I also wanted to compliment you. That was an excellent staff report.
Oh, thank
Really
you.
appreciate the work you put into it.
Good, thank you.
So to be
Vicky?
clear, then the motion is that to the end plus 60 days, and then the program, as presented with the new signage, is then terminated.
Right, because we're extending the pilot program. When the parking lot comes online, 60 days, we're done.
The new signage comes into place.
Right. And another issue that I want to touch on, without opening too big a can of worms, is we get a lot of pressure from a lot of other neighborhoods about restricted parking. And I really don't want to keep on doing that, because eventually it would get really bad. And I don't like going to visit other towns where you see the signs on the street, this is permit parking only. It really, I mean, we want to be a nice, friendly city, and I think we are. But going down that path would not be something I want to do.
Dan, I really appreciate that. One of the other things I wanted to mention is that there are other neighborhoods involved, and this is a public street. So I actually am in that neighborhood a lot, and it's frustrating to be there when the, restaurants are full and you have all the overflow parking, but you have to do what's fair to all the neighborhoods. So I appreciate that.
Any further discussion? Roll call, please, Renata.
Wood,
Yes.
Miller,
Yes.
McEvers,
Yes.
Gookin.
Yep.
English,
Yes.
Evans.
Yes.
Motion carried. Thank you, Hillary. Now we will have resolution number 20-020, declaration of intent to exchange real property with Active West Developers and setting a hearing of April 7th, 2020 for the consideration of said property exchange of city land owned on Blackwell Island on parcels 3 and 4 of the former Union Pacific Railroad right-of-way between La Crosse and Lakewood. Troy.
Good evening, Mayor and Council. The goal here tonight is to share with you the plan that you have been working on and ask staff to go forward with, which is moving into accessibility to La Crosse Avenue, which goes into Riverstone. So with that goal in mind, staff has been working to see if we can find a way to acquire the property necessary to get off of the Northwest Boulevard, access La Crosse Avenue, and get all the way into Riverstone. In so doing, we've come up with a piece of land on the screen here, which is on Blackwell Island. It's 1.83 acres. We are proposing to set a public hearing so that Active West, which would be the purchaser of said property in Riverstone from the Union Pacific Railroad. And this map is full of lines, but if I take you to the right-hand side, it's Northwest Boulevard. This is La Crosse, which is not at all developed. If I go down here, this is the Spokane River, and Bella Reeve is here. The city of Coeur d'Alene does not have full connectivity over to Lakewood, which is where the arrow is right now. This land is owned by the Union Pacific Railroad. We do have Active West that has acquired the property that Ignite had over here at this point with the cursor and is looking to acquire the land, and this is where the road would go. So on this map, this is the access that La Crosse would have coming off the boulevard, coming in here, and ideally the bulk of the traffic goes to Lakewood, because right now that's where we have traffic signals. However, this is a public street that would go all the way over to BB. So again, it's very difficult to build a road on land that you don't own. So staff, including Mr. Gridley from our legal department, we have worked with the Bureau of Land Management on the leased property that we have down here. It goes right to this line. This again is drawn in as a public safety connection over to Bella Reeve and a parking lot. These small little parking spaces on this particular map haven't been approved, but we've drawn it in because this is the area in which we're looking to do the land trade so that we can build the road and potentially get more parking off of the BLM and have it on this location. This gives us good access down to the boardwalk as well. So again, you'd be setting up a public hearing. Parcels 3 and 4 are in this middle section. We have the legal descriptions. Active West would build this road. Active West would also buy property over here. This is all Union Pacific Railroad right-of-way. So we bring this forward as a proposal. We would propose to you to use tax-assessed valuations. The property the city owns on Blackwell Island is valued at $300,000. Active West would take approximately $169,000 for the square footage that the city needs to acquire to build the road on, thus the difference being $131,000. So we're attempting to do a land exchange with other consideration, and that being dollars. Again, Council, we are working based on your recommendation and your vision. We'd also like to bring Ignite into this as we go forward. As the Lake District closes down, we would like, and you have directed us to look at signalization here at La Crosse and the building of this road, along with a relationship with our Bella Reeve homeowners, because they have an obligation to assist with this connectivity in their homeowners associations agreements. So again, giving you the background, you have directed us to go this way. It would provide much improved ingress and egress into Riverstone. It would be good for public safety. It would be good for the public to be accessing this BLM property as it develops in the future. And with that, I would stand for any questions you may have.
Council's questions for Troy?
Mr. Mayor?
Yes.
It's not so much a question, is it? It does seem that it's following the vision of the city, and it does open up a major arterial, so it doesn't seem to be too controversial. Can you tell me a little more about the public hearing process, Troy?
Yes, the city has a restricted way in which it can move its land. So transfers are the basic, easiest way, and the public gets to comment on those types of transactions. So we're not selling it, we're exchanging it and taking other consideration, that being the cash, to make up the difference in the two different valuations.
Thank you.
Any other questions for Troy? If you don't have any questions, we'll be looking for council action.
Well, Mr. Mayor, I would move to approve Resolution 20020, which is declaring an intent to exchange real property with Active West developers and setting of a public hearing on April 7th, 2020, pending for the consideration of said property exchange of city-owned land on Blackwell Island for parcels 3 and 4 of the former Union Pacific Railroad right-of-way between La Crosse Avenue and Lakewood Drive.
We have a motion. Do we have a second?
Second.
Motion and a second. Further discussion. Dan?
Yeah, and the reason I said pending is because we are unclear on the status of the April 7th meeting, and therefore this may be postponed.
Okay.
There will be an ad in the paper, notice in the paper. Yes.
Any further discussion on that? Roll call, please, Renata.
English,
Yes.
Wood,
Yes.
Evans,
Yes.
Miller,
Yes.
McEvers,
Yes.
Kukin.
Yes.
Motion carried. Thank you, Troy.
Move to adjourn, sir.
Second.
Motion and a second to adjourn. All those in favor?
Aye.
Everyone be safe out there. Follow the rules. We are adjourned.